So if you picture someone with PTSD, you almost certainly picture a soldier.
Right, yeah, that's the default.
Yeah, you picture someone in uniform, returning from a war zone, carrying these profound invisible wounds of the battlefield.
Absolutely.
And it is an image so deeply ingrained in our cultural consciousness that it has basically become like the exclusive definition of trauma.
It really has.
But the statistical reality, I mean, the person with PTSD is just as likely the mother who had a terrifying, life-threatening delivery.
Yeah, or it's the teenager who barely survived a mangled car wreck on the interstate.
Exactly. Or it's the coworker sitting right next to you who grew up in a profoundly volatile household. So today we are diving into a fascinating stack of clinical notes and practice data to completely redefine our understanding of trauma.
We really need to.
We're dismantling what is essentially the biggest blind spot in modern mental health.
And, that blind spot is literally costing people years of their lives.
Yeah, for sure.
Because when we restrict a medical diagnosis to one specific demographic, we inadvertently silence millions of others who are walking around with the exact same neurological injuries.
That's so true.
The sources for today's deep dive reveal a massive systemic issue. We're looking at a phenomenon where PTSD is routinely, almost systematically, underdiagnosed outside of veteran populations.
Which is wild when you actually look at the numbers.
It is. So this deep dive isn't just about exploring mental health. It's really a crucial exercise in critical thinking regarding how we label and validate human suffering.
Right. Okay, so let's start with that expectation of precision we usually have with medicine, right?
Mm-hmm.
Like, if you break your arm, you go to the hospital, the x-ray shows a jagged white line, and the doctor points at the screen and says, there is the problem.
It's objective.
Exactly, it's clean, you get a cast. But when you step into the world of psychological trauma, that x-ray machine doesn't exist.
No, it really doesn't.
The diagnostic landscape is incredibly murky. So if we want to understand why everyday people are falling through the cracks, we first have to look at what actually causes it.
We have to shift our focus completely away from the battlefield.
Right. We have to look at everyday life, and the actual triggers for civilian trauma in these clinical sources are they're staggering when you pull back and look at them.
They are hiding right in plain sight.
They really are. We are talking about motor vehicle accidents, medical trauma like spending weeks in an ICU or waking up during a procedure.
Oh, wow. Yeah, that's a big one.
Sudden loss of a loved one, interpersonal violence, and a massive one that the sources call ACEs.
Right, adverse childhood experiences.
Exactly, which includes profound childhood neglect. Okay, let's unpack this a bit.
Go for it.
Think about the brain's threat response system like a household smoke detector.
I like that.
It is installed in your brain just to keep you alive. But that smoke detector, it does not possess context,
No, it's just an alarm.
Right. It doesn't know, and it certainly doesn't care if the smoke setting it off is coming from a massive, roaring forest fire in a combat zone, or if it's coming from a contained kitchen fire.
Like a terrifying hit and run on the highway.
Yes. Once that alarm gets tripped and the wiring gets jammed in the on position, the ringing in your ears is identical.
That's such a perfect way to frame it, because clinically speaking, the alarm doesn't discriminate.
Right.
The sources anchor this with actual clinical context. They point out that the nervous system's footprint of a horrific car crash looks practically identical to combat trauma.
Wait, really? Identical?
Yes. The diagnostic manuals like the DSM-5, they require an event to meet a specific threshold. It's called DSM-5 Criterion A.
Okay, what does that actually mean?
It essentially means exposure to actual or threatened death, serious injury, or violence.
Wow.
And these everyday civilian events, they meet that exact same diagnostic threshold as combat. The core symptoms are exactly the same.
So the brain's architecture is responding the exact same way, but the societal response is wildly different.
Completely different. And this is why it matters so much. We essentially train civilians to minimize their own experiences. We condition people to say, it was just a fender bender, insurance paid for the car, I should be over it by now.
Right, or like, plenty of people have difficult childhoods, I just need to tough it out.
Exactly. We train civilians to gaslight themselves. We invalidate the blaring alarm bell in our own heads because the fire wasn't deemed, big enough by society's totally arbitrary standards.
Which means you never seek help.
Never.
Because if the world tells you your trauma isn't real, you just try to quietly carry it. But carrying it has physical consequences.
Massive physical consequences.
So how does this actually manifest? Because if you are a civilian, the signs of PTSD, they are incredibly stealthy.
They disguise themselves as just the heavy cost of doing business in the modern world, you know?
Yeah, just everyday stress.
You might think you just have a stressful job or like a bad caffeine addiction. But your nervous system is actively altering your daily patterns.
Yeah, the sources detail some really specific symptoms here. Sleep disturbance, nightmares.
Hmm.
But a huge one is unexplainable hyperarousal. Let's unpack hyperarousal. What does that actually feel like for the person experiencing it?
Okay, so imagine your body is a car and someone has put a brick on the gas pedal
Okay.
while simultaneously pulling the emergency brake.
Oh, wow. That sounds awful.
You are exhausted, but you are humming with this terrifying vibrating energy. You're constantly on edge.
Like sitting facing the doors in restaurants.
Yes, exactly. Or startling violently if someone just drops a pen.
Yeah.
Your brain is permanently scanning the environment for the next threat.
Because your internal calendar has basically broken down.
Right. To your brain, the terrible event isn't in the past. It feels like it is happening right now continuously.
And because you feel so wired all the time, your sleep is completely destroyed.
Oh, totally.
But the symptom that I think disrupts a person's life the most silently, and the sources talk a lot about this, is the avoidance behavior.
Avoidance is the defining behavioral shift. It's not just, preferring to stay home in your pajamas.
Right.
It is your brain subconsciously building an ever-shrinking fortress just to keep you safe from triggers.
Yeah, you see people adding 30 minutes to their daily commute just to avoid the specific intersection where they were T-boned 2 years ago.
Exactly. Or ghosting their closest friends because those friends remind them of a period in their life before a sudden loss.
And you just think, why am I acting like this? What is wrong with me?
You start to feel completely broken.
Hmm.
And the really tragic part of avoidance is that it works perfectly in the short term.
Wait, what do you mean it works?
Well, when you avoid that intersection, your anxiety instantly drops. Your brain rewards you for the avoidance.
Oh, I see.
But in the long term, your world just gets smaller and smaller and smaller until you are entirely isolated.
That is so heavy. So someone listening to this might be recognizing these exact patterns in themselves right now. The hyperarousal, the shrinking world.
I'm sure many are.
And there is a specific resource mentioned in our notes that we need to talk about here. There is a free 3-minute PTSD screening tool available at trechtherapy.com, mental health tests.
Yes, that's a great resource.
Now, I am going to push back on this quite a bit.
Okay, let's hear it.
Can a 3-minute internet test really tell you anything meaningful about a complex trauma disorder?
It's a fair question.
I mean, it sounds a bit like one of those magazine quizzes that tells you what kind of pizza topping matches your personality, you know? How much weight can a person really put on a quick web form?
Well, this raises an important question, and honestly, a healthy dose of skepticism regarding internet health quizzes is always warranted. We've all seen the clickbait.
Right, exactly.
However, the architecture behind this specific tool is entirely different. The sources specify that this isn't a generic quiz. It is a PCL5-based screener.
Okay, so what does PCL5 actually mean for the person taking it?
It stands for the PTSD checklist for DSM-5.
Okay.
It is a standard, heavily validated self-report measure used by actual clinicians, psychiatrists, and researchers worldwide.
Oh, so it's a real medical tool.
Exactly. It doesn't just ask if you feel sad. It measures the specific physiological severity of the symptoms we just discussed.
The hyperarousal, the intrusive thoughts.
The avoidance, all of it. What this 3-minute tool does is provide actual severity scoring and a referral pathway.
So it takes the invisible and makes it visible.
Precisely. For someone sitting in that dark place, wondering why they can't sleep or why they're terrified of getting in a car, this isn't just a quiz.
It's an answer.
It is a crucial aha moment. It provides a real, scientifically backed name for the invisible weight they're carrying.
And validation is incredibly powerful. Once you have a name for your pain, you realize you aren't losing your mind.
Right. You are having a normal reaction to an abnormal event.
But validation without intervention is kind of just a cliffhanger.
Yeah, that's the hard truth.
So you take this test, you get a high score, and suddenly you have a name for what's happening. The next monumental hurdle is what you actually do with that information.
Accessing care is a massive barrier.
Finding a specialist who actually understands trauma, who is accepting new patients, who is geographically close to you, and who you can actually afford.
It's overwhelming.
It feels like trying to run a marathon in waist-deep water.
And wait lists for specialized mental health care, especially post-pandemic, can be like 6 to 8 months long.
Wow, half a year.
And if you live outside of a major metropolitan hub, you might be in a total mental health desert.
Well, that is the exact gap that the practice hosting the screener is trying to close. The practice is called Coping and Healing Counseling, or CHC.
Right.
They are based in Georgia, and the source material provides a blueprint for how they are actually fixing this access issue.
Their logistical model is really something.
Let's dive into that because it fundamentally changes the logistics of getting help. They are a 100% IPAA-compliant telehealth practice, and they serve all 159 counties in the state of Georgia.
The infrastructure required to serve all 159 counties is a massive logistical achievement.
I can imagine.
It means the person living in a rural agricultural town has the exact same access to top-tier clinical care as someone living in downtown Atlanta.
That's huge. And they have built a deeply diverse, culturally competent team of over 15 licensed therapists. They treat teens from age 13 up, individuals, couples, families. They even offer life coaching alongside therapy for anxiety, depression, grief, and relationships.
It's a very comprehensive approach.
But we need to clear up the alphabet soup of credentials here in the notes. They employ LCSWs, LPCs, and LMFTs.
Let's translate those for everybody.
Please do.
So an LCSW is a licensed clinical social worker. Their superpower is looking at your trauma not just as an individual brain issue, but looking at your environment, your family dynamics, and your community.
Okay, that makes sense.
Then you have LPCs, licensed professional counselors. They focus heavily on the individual psychological healing process.
Right.
And LMFTs are licensed marriage and family therapists who specialize in how trauma fractures relationships and, crucially, how to repair those specific bonds.
Here's where it gets really interesting to me. Finding out you have PTSD is basically like finding a massive leak in your basement, right?
Oh, good analogy.
Standard talk therapy is sometimes like having someone come over, sit next to you on the stairs, look at the water, and ask how the leak makes you feel.
Right, which doesn't stop the water.
Exactly. It doesn't actually fix the pipe. But CHC's model is like finding a master plumber who is essentially free, can fix it remotely, and speaks your exact language. They provide specific, evidence-based trauma modalities.
They do, and it is vital to understand the mechanics of these treatments to see why they are so effective.
Right.
Because CHC doesn't just do talk therapy. They specialize in EMDR, CPT, and prolonged exposure, or PE.
Let's break those down, starting with EMDR, because it sounds almost like science fiction the first time you hear about it.
It really does.
Eye movement desensitization and reprocessing. How does moving your eyes actually fix the memory of a car crash?
So it goes back to that internal filing system we talked about earlier. When you experience a trauma, the memory doesn't get filed away in the past events cabinet.
Because the alarm is stuck.
Exactly. It gets stuck in the active threat folder, which is why flashbacks feel so incredibly real.
Okay.
EMDR uses bilateral stimulation, often having the patient track the therapist's fingers moving side to side on the screen or using tapping methods while gently focusing on the traumatic memory.
So what does that bilateral stimulation actually do to the brain?
It engages both hemispheres of the brain, heavily mimicking the rapid eye movement, or REM sleep, where our brains naturally process daily information.
Oh, wow. Like when we dream.
Yes. It essentially jumpstarts the brain's natural healing process, allowing that traumatic memory to unfreeze.
That is fascinating.
It takes the memory out of the active threat folder, strips away the intense emotional and physical charge, and finally files it away as just a bad memory from the past.
So you don't forget it happened.
Yeah, you don't forget the event, but the alarm bell stops ringing when you think about it.
That is incredible. And the sources say they also utilize CPT, or cognitive processing therapy.
Yes. CPT approaches the trauma from a totally different angle. Trauma doesn't just give you nightmares, it completely shatters your core beliefs about the world.
Give me an example of that.
Well, say you survive a traumatic birth, and your brain decides hospitals are fundamentally unsafe places, and my body cannot be trusted.
Right.
CPT is a highly structured process of identifying those extreme, distorted beliefs and systematically dismantling them. You learn to rewrite the story you tell yourself about why the trauma happened.
Now, doing this kind of heavy neurological rewiring via telehealth, isn't doing trauma therapy through a computer screen less effective than sitting on a couch in a doctor's office?
You know, that is a really common assumption. But the clinical evidence suggests the exact opposite, particularly for trauma.
Really? Why is that?
Think about what we said about hyperarousal. If your nervous system is permanently on edge, Just driving to a strange office, sitting in a sterile waiting room under fluorescent lights, and talking to a new person.
Oh, I see.
It can spike your anxiety before the session even starts.
Yeah, you are already in a defensive posture.
Exactly. Doing EMDR or exposure therapy from your own couch, wrapped in your own blanket with your pet sitting right next to you, provides an immediate baseline of safety.
That makes total sense.
Your brain is much more willing to do the hard work of processing trauma when the physical body feels entirely secure in its own environment. Telehealth turns out to be an incredibly powerful medium for this specific type of healing.
But, even the most brilliant, effective telehealth model in the world means absolutely nothing if the patient can't afford to log on.
That's the tragic reality of healthcare.
The barrier to entry for specialized trauma care, like EMDR, is usually thousands of dollars out of pocket. Many specialists don't take insurance at all.
No, they don't. The financial realities often dictate who gets to heal and who is forced to suffer.
Right. But this is where CHC's model transitions from being clinically impressive to being a real systemic game changer. They have optimized their practice to accept major commercial plans.
Right, the big ones.
Yeah, Aetna, Cigna, Blue Cross Blue Shield, United Humana. Depending on the plan, a specialized trauma session can range from $40 down to literally $0.
Which is fantastic.
But the breakthrough, the thing that genuinely changes the landscape in Georgia, according to the notes, is their approach to Medicaid.
Accepting Medicaid with a $0 copay is how you actually dismantle mental health inequality.
I mean more about that.
Often, the people who experience the highest rates of complex, layered, trauma-like systemic poverty, community violence, chronic medical issues are the exact populations who are priced out of evidence-based treatments like CPT or EMDR.
They just can't afford it.
Exactly.
Yeah.
So by integrating Medicaid into a high-level telehealth model, CHC has effectively removed the wealth tax on mental health recovery.
They are saying that your zip code and your tax bracket should not dictate whether or not you have to live with a blaring smoke detector in your head for the rest of your life.
It creates an on-ramp to healing that simply didn't exist for a massive portion of the population.
It really is amazing. So let's bring all of this together for the listener. If there is one thing you take away from this deep dive, it's that we have to fundamentally alter our cultural definition of trauma.
We really do.
PTSD is not a uniform you leave behind on a battlefield. The triggers are driving next to us on the highway, they're happening in delivery rooms, and they're echoing from our childhoods.
The injuries are real and they're structural.
Yeah.
But importantly, they're also entirely treatable.
Yeah.
The hyperarousal, the exhaustion, the shrinking of your world through avoidance, these are not permanent character flaws. They are just symptoms of a nervous system that needs to be rewired.
And thanks to innovative, accessible models like coping and healing counseling, finding out where you stand and getting those master electricians in to fix the wiring is easier than ever.
It truly is.
If you're listening to this and you recognize the hyperarousal in yourself, or maybe you see a friend whose world keeps getting smaller and smaller, you have a concrete next step.
Take that validated screener.
Exactly. You can take the screener or reach out to their clinical team. You can call them at 404-832-0102. You can explore the modalities we talked about at sheettherapy.com. Or you can even email them directly at support@sheettherapy.com.
And honestly, having that information isn't just about personal health. It's about being an informed member of your community.
Absolutely.
Because once you understand how trauma mechanisms work, you start seeing the symptoms everywhere. And I think that leaves us with a lingering thought to consider today.
What's that?
Well, we've established how incredibly common civilian trauma is. And we know that the primary symptoms include chronic hyperarousal, deep sleep deprivation, and a desperate need to avoid pain. If that is the neurological reality for millions of people, how much of our everyday societal conflict, our widespread workplace burnout, or even our most deeply fractured personal relationships is actually just untreated, unrecognized PTSD walking around in plain clothes?
Yeah. It really makes you look at the person cutting you off in traffic or the coworker snapping at you in a meeting in a completely different light.
It certainly does.
Keep that internal smoke detector in mind next time the alarm bells start ringing. Until next time.